Having come into hospital, you will have been seen by your treating surgeon, who will have consented you for the procedure that you're about to have and will have marked the affected part of your body to ensure the right part is operated on. The nurses will have also seen you to make sure that you have the right patient to answer any questions and to talk to you a bit about what's going to happen after the operation. At some time you'll be called down to theatre, which you will generally walk down to theatre with one of the nurses from the ward, and you will be able to wear your own dressing gown and your own slippers. As you come into the anaesthetic room that we're in now, there will be generally 2 or 3 people in the room. There will generally be the anaesthetist, who is the person responsible for you going to sleep if that is the anaesthetic that you are having, and the anaesthetist will have an assistant, often called the ODA or anaesthetic nurse or tech. The surgeon treating you may well be in the anaesthetic room at the same time, and another person if necessary. As you come into the room, you'll be helped onto the bed and a number of questions will be asked relating to your name, date of birth, what operation you're having, and then certain things with regards to when you last ate and whether you have any problems with your teeth, etc. The anaesthetist with the anaesthetic assistant will then insert a needle into the back of your hand in order for the anaesthetic to take place. During this time you'll be told what is going on, and obviously if you have any questions you should ask at any time. You will have some monitoring equipment put on you at this stage in the anaesthetic room, which will include a blood pressure cuff, normally on your right arm, a probe on your finger which will measure the oxygen levels, and there'll be 3 sticky leads placed on your chest which are looking at your heart rate. You will have a mask put generally on your face at this time to give you some oxygen before the anaesthetic takes place. And if you feel claustrophobic or don't like the idea of that, then someone can hold the mask close to your face, and you should let someone know if this is the case. The anaesthetist will inform you throughout this what is going on, and will give you some anaesthetic agent, normally through the needle that has been put into your hand, and also with some anaesthetic gases which will go through the mask, and this will often give a slightly different smell. You will feel yourself going off to sleep, and at this stage you should relax and think of something enjoyable before going into theatre to have your operation. The next thing you'll be aware of is waking up in recovery having had a successful operation.